yeah.
Oh God. Okay.
Yeah.
Well, I mean, once you're at that point, it's kind of like, shoot your shot,
I get you might as well try, right?
Exactly.
Life is too short, and it's really short at
It
that point.
really, yes,
That sounds
yes.
shitty.
And honestly, after that experience, my entire view of life changed. Like seeing my baby was like the most amazing thing ever, just to be able to see him again. I cried forever just hugging and holding him.
You're probably grateful from some aspects that it happened because you probably have a much
I
greater
do.
appreciation.
I am grateful, and I feel like it
Yeah.
happened for a reason.
Yeah.
And that being, like I felt much closer to God after that.
Yeah. And
Like,
you're healthy now, so it's like,
yes.
good.
It was definitely a long road though, a few years. Um, and so just seeing my baby, like I made sure that he was there almost every day at the hospital, and they're like, we're freaking out a lot of the time because then he'd try to like rip out my IVs and stuff.
He's in that age where he's like
Yeah.
into everything.
Yes, yes. He
Yeah.
was only like 3 or 4,
Like those
so
kids, like they kind of mess things up. Like
yeah.
that's why there's child guards on everything.
Yes, or he'd jump on me or something, and
Yeah.
they're like, calm down.
He doesn't
Like,
know
this
that
is
mom
a
can't
hazard.
handle like
Yeah.
him using your belly as a trampoline.
Yeah, exactly. And I was just like, but it was just so nice to see him and my parents, Uh, and then so once I did get home, my parents really stepped up. My brother-in-law is amazing. He's my older sister's um, husband. He's been
Yeah.
in the family. I've known him since I was maybe 12.
He's a rock then.
Yes, he is
Yeah.
like my big brother.
Mhm.
And he was out there mowing my lawn because it was like 2 acres. It wasn't a small feat.
You need a
And
tractor, really.
yeah,
To shred it.
yeah, so we didn't have one. So
Yeah.
he was out there and riding lawnmower,
Yeah.
mowing it
Yeah. At least it
all
wasn't a
freaking
push
day.
mower, but
Yeah,
yeah,
exactly.
it's still a lot even on the riding lawnmower.
And I was so shocked with the dedication that my mom had. She would go every morning, would make me breakfast, and get me up. Um, I needed help taking showers, so my mom and my sister would help me. Um, I did realize once I got home that I did have deficits, and I couldn't really walk by myself. I had the part of the brain where it affected is the cerebellum, which really plays a big role in your balance, and so I still felt a little bit out of it.
Yeah.
But if I could describe like a stroke, I would probably say it's kind of like when you're drunk. So a lot.
I felt that
time.
before for sure.
Yeah, I was gonna say a long time. I could not even
Yeah.
drink because you feel like whenever you're drunk, you feel like you have no control of anything.
It's almost like PTSD at that point.
Yeah,
like
yeah.
You're
So I
going
couldn't
back
drink.
to it.
Yeah, I couldn't drink for a long time, just because I didn't like being out of control of my body.
Yeah.
Like at all.
That makes sense.
Yes, and so I was in a walker, and I did end up getting home health eventually. So that was a better option for me. And I was grateful that I was able to get home health. And a lot of people didn't even know what to do for me at that point.
Mm-hmm.
Like, I remember they were talking about physical therapy, but all my muscles are fine and everything. So what they really wanted to focus on was vestibular therapy, which that is therapy that focuses on like balance.
Okay.
And so it was very interesting to me, especially from a nursing standpoint, that one of the person that I had for PT, he suggested mimicking or redoing all the steps like as an infant would. Like, okay, at first you roll over, then you start to crawl,
Wow.
and then you start to,
And you actually had to do all that.
Yes, yes.
That's got to be a weird feeling.
Yeah, it was very
kind of
strange.
helpless. Like,
Yeah,
what am I
yeah.
doing? Like, I feel like literally like an infant or a toddler.
Yes,
But
yes.
your brain is an adult, like a grown-ass woman.
Yes.
So
neuroplasticity, though, the younger that these kind of things happen, the more your brain can kind of compensate for those things.
Yeah.
So that part of the brain is dead. It's done. And especially for me, like it had been over 24 hours until I got diagnosed. Like the next day.
So you got to redevelop all of that?
Yeah. So it's just making new connections in your brain. So it's the neuroplasticity part of it. And your brain is able to make new connections. And so you can make up for a lot of those deficits by rewiring your brain or exposing it to these things. And the more you expose it to these challenges, the more it grows. Yeah. Does that make sense? Like those connections grow to where it can compensate. It wasn't until probably the week after I got home that all of a sudden one day my arm went numb and I felt like I couldn't really feel it. And it happened for like a few seconds. And then I was okay. I didn't projectile vomit or anything, and my vision was okay. I was just sitting there, and all of a sudden I felt like I was going to pass out. And then I was like, oh my gosh. And then like my arm went numb and my leg kind of went numb, and I was just kind of sitting there like this. And then I was
like the left side of your body?
yeah. And then I was like, oh my God, I don't know what that was, And then I told my family, and then they're like, you need to go in. And so I told my ex-husband, I was like, hey, I need to go in because this is happening. And it didn't even just go away. Like it kept, like it would go away and then it would happen again. And it'd go away and then it would happen again. And I was like, I don't know what's going on. I thought I was having another stroke, full on panic attack at that point. We make it to the emergency. I told them, I was like, I don't think it's an actual stroke. So let's just go to Hendricks North. So that's an ER, but it's not one for, to handle things like that.
Yeah.
So we went.
So why'd you choose that?
I didn't think it was another stroke. I just thought maybe I needed something for my neck because I was hurting.
Yeah.
And because I had a lot of neck pain afterwards. So I don't know why. I guess because of the artery that
you still have issues?
Yes, I had neck pain for a long, long time, and I still do sometimes.
Yeah.
And I think I was just really tense. So like for a year and a half, I walked like this, and my shoulders were like at neck level, and I was just like, and then whenever I'd turn, I'd be like, yeah.
You turn your whole body and not your neck.
Yes. And I never realized it until somebody told me, they're like, does your neck hurt? And I was just like, yeah. And they're like, you can tell, like your shoulders are up to your neck. You're stiff. You're just like turning like this. And I was just like, I don't know. I'm also like panicking 24/7. So I'm like, I don't know what this is. But that time I went in, and then when we were at Hendricks North, I told her what had happened. And the nurse there was what I aspired to never be. She scolded me like I was a child. She says, once you have a stroke, you're more likely to have another one, which I'm like, I understand that, but she's like, you should have come in here sooner, and these are all signs of a stroke. I'm like, but I just had a stroke. She's like, you can have another one. What if another clot through? Like freaking out. No, which I understand. But I wasn't freaking out when I went in there. By the time I left, I was so scared, and I was like, oh my God, I could have a stroke at any time. You know what I mean? And so I kind of fueled that insecurity that I had over it. Mm-hmm. Then I was like, and then people aren't going to catch it. And then it's like, then came just absolute freaking out, panic attacks at all hours of the day. Because they cleared me on that. They said, that might happen, for a few weeks because of what happened. And I'm like,
sounds like they dismissed it in a sense, though.
Yeah, I mean,
like if you're having the panic attacks and stuff still, is it common for that to happen? You probably, if something seems just a little off.
I honestly wasn't even worried about it, because by the time they saw it, I felt like back to normal. It wasn't until I left that I felt like I couldn't, I didn't have enough equilibrium. So I was with the walker, but those symptoms, like I hadn't felt them. Like I don't remember feeling them whenever it happened. I remember falling over and having to put the vehicle in park, and then just kind of being there, and then just like opening it, and then just projectile vomiting everywhere. I remember that, but I don't remember the sensation. It wasn't until afterwards that I felt that sensation. But again, I was really confused whenever it was happening, because obviously my brain wasn't getting enough blood or circulation to those areas. And so then I started feeling those things, and it just felt like it was brand new, but then it felt like it was the exact same thing that happened, because I didn't really realize everything that did happen, or even get a chance to digest and even think about it until after it happened, because whenever it was happening, I was just confused. So it wasn't until afterwards that I was thinking about it, that I was like, oh, that's what happened, and could really think about it and just kind of try to make sense of it. But yeah, she freaked me out. Then I felt like I was having panic attacks all the time. And so I went to my doctor, and I told her, it was somebody that I actually had worked with previously. And so I knew her personally, and I told her, I was like, look, I want you to be my doctor because I know you, and I know that you'll do the best. Yeah. I'm like, I know.
How long did these panic attacks go on before you? Just total?
Well, I hate to admit it, but for years, but not to that extent. So
not as severe.
Yes.
So were they intermittent? Like how often were you having them?
In the beginning, a lot. So here, I'll go on to explain that. Okay.
Sure.
So I talked to Dr. Gray. She referred me to A neurosurgeon.
This is the doctor you trusted, is Dr. Gray, right?
Yes, and I took her on as my primary care doctor, and I told her, like I told her exactly what was going on. I was like in tears working with her, in her office, and I was just like, I don't know what to do. Like I'm at a point where I don't know what I'm supposed to do. I don't know how to go on from here, but I want things to be better and I want to get better. And she's like, you gotta, just try to calm down. And I'm just like, everything is just, I'm 20 something years old. I get told this, I just freaking miscarried not that long ago. I'm like, my life is a shambles. And then thank God my family stepped up and, like my mom was going over there, making me breakfast every single day. She never missed a day. She took time off of work. My dad was out there, would feed all my animals, take care of the farm. And then my brother-in-law was out there mowing whenever he could. And if I had any issues, he'd go over there. And then my sister would clean and my other sister would go and help me shower. Awesome. Which was really embarrassing to have to go through that. Yeah.
There's no modesty at that point, even if they're your sister. Like they've seen you like that before, but not as an adult.
Yes, and then I had like a little baby, you know, and then it was just craziness. And so whenever I talked to Dr. Gray, she sent me to a neurovascular surgeon that was top notch in Dallas. I think he was at UT Southwestern.
Okay.
And so I went to go see him. He got me in super quickly, which I thought was very much a blessing. And I went and talked to him, and he didn't really know too much about the clotting disorder part of it, but he was an expert when it came to vertebral artery dissections, because if they were bad enough, you could do a repair. Okay. He said that's not an option for you, but he helped to make me not feel crazy.
And why wasn't it an option?
Because it wasn't that bad, honestly. Okay. It was just like the inner layer that was torn. And once I was on the blood thinners, it got rid of all the clots, and then it could heal normally. And it did heal. And some people don't regain patency, which means that, blood can flow through there. Sometimes their whole artery will close or, not do well. And so
mine just doesn't function anymore, kind of, or?
Yeah. Some people, or they'll just have a lot of scar tissue. Like there's complications. Mine, thankfully, worked like a charm. It healed very, very well. Not an issue with that. We don't really know what caused the dissection. They said it could have been anything. It could have been like popping your neck. It could have been like I had a laptop in the back seat, so just grabbing it and pulling it over. If I cricked my neck the wrong way, that could have caused it. Or it could have been completely spontaneous. We do not know. And then I was also dehydrated, so that didn't help any of the situation. But I told him about everything that happened. I told him, I was like, I just don't know what to do at this point. And he's like, he told me straight up, he's like, you're not crazy. And I was like, okay, well, can you tell me what's going on? I'm like, I just need an explanation. I need to know. He's like, these people don't know what's going on because they don't deal with this. It's like vertebral artery dissections are not very common.
It's like Greek to them.
Yes. He said they're not very common. He's like, but whenever people do have them, they have a lot of symptoms like what you say.
Yeah.
And so he validated everything I was saying. He said, whenever you have a stroke, you're going to have like waves of symptoms. He's like, that part of your brain is dead now. So what happens is your body tries to compensate. Well, anytime you're sick, anytime you're stressed, for me, it was whenever I got overheated or overstimulated, those connections drop. They can't compensate anymore. So then you have to try to, and that's when the symptoms come out, right? That's whenever I started feeling the numbness. That's whenever, I'd get tachycardia, like my freaking heart would start racing out of nowhere. And it was because my whole arm and leg were numb. And then he's like, that's what it is. And he's like, so you're just going to have to try to stay hydrated as much as possible and just work through it. And he showed me how to do like neuro checks on myself, which I had already looked it up too. So he's like, do a neuro check on yourself. If you can do all of that and you're feeling sick, then you don't have to go in.
So out of curiosity, what does a neuro check entail?
Well, I mean, it's just like making sure that you have hand-eye coordination, making sure that you have enough grip on both. People that go like this and like put their hands out like a zombie, Sometimes if you're having a stroke or anything, one of them will be down or
Okay.
not be able to function at all.
Okay.
Being able to make faces, in the mirror, being able to see yourself do that, being able to look at an object, touch the object, and then touch your nose is a big one. That's for hand-eye coordination.
Almost sounds like a sobriety check.
Yeah, it really, it has a lot to do with that too. Just because that's, just a part of the process. And I mean, you can look up neurological check, and you can. That's what I was doing, is just doing those on myself, and that helped to really reduce my ER visits, because I had already gone to the ER maybe 2 or 3 times by this point.
Just freaking out, not knowing.
Yes, full
what's
on
going
panic
on.
attack, and then I had to get freaking anxiety medication, and then I was okay. But I mean, it's embarrassing, and especially being a nurse, like, you don't want to be seen as the crazy patient, and then it's like, oh, you just happen to be the crazy patient. It's like, oh God.
You seem fairly normal now.
Yeah, exactly. Yeah, a little bit.
Yeah, a little normal, close to it.
But it was just like so frustrating, because they were like, everything's fine, I don't know what's wrong with her, and it's just like, it wasn't just the panic attacks. I'm like, I'm really feeling this. Like, my arm is literally going numb, and I'm like, and I can't move it for like, but it only lasts like 10 seconds. And then I can move it, and I was just like,
that's so odd. It's gotta be a weird feeling.
Yes. And I was just so frustrated. And then whenever I talked to him, and he was telling me like, no, you're all of a sudden going to feel like that when those connections are being met, or if you feel really dehydrated, or if you're outside for a really long time, and then, you get overheated. He's like, then you're going to start getting all those symptoms again. And he told me, he's like, you're going to get those wave of symptoms, and that's going to be normal. But as time progresses, those symptoms will be less and less and less and less.
Did you ever doubt yourself? So 10-second intervals of not having that sensation, I'm sure it felt like 30 minutes. Yeah. Did you ever find yourself like, am I going nuts? Is this really happening? Or were you fairly certain?
No, I knew it was happening. Yeah. I knew exactly what was happening. I'm like, I'm feeling this. I'm like, I don't care what y'all think. I know exactly what I'm going through. And then at the time, I'd actually found a Facebook group for the blood clotting disorder that I had, which was antiphospholipid syndrome. And I also found a Facebook group
Never trying to say that.
Vertebral artery dissection.
Can you spell that?
Yes, I can.
Okay, let's hear it.
No, I have to write it down.
Serious. I can't. Oh, okay, you can't spell it out loud.
No, not out loud.
Okay.
But anyways, and so I joined those 2 Facebook groups, and a lot of people were having the same symptoms.
Yeah.
And a lot of them were very scared that it was going to happen again. And then with me, I feel like I was perfectly fine, and I wouldn't have had panic attacks had that nurse not come in there yelling and scolding me and being like, you can have another stroke. And then I was like, and then I started panicking, because then I was like, oh God, I'm going to die,
What a crappy healthcare professional.
Well, I mean, she has, I agree. I don't, now taking that into consideration, I know not to act like that. I would just have educated, but I would not have gone in there freaking out. And she was freaking out.
My mom's a nurse. She's an RN. She has been for years, and she's a house supervisor at a hospital. I can't imagine her ever acting that way. It's just not in her character. And it just sounds really shitty for someone to do that.
Yeah. And it's like, I had those symptoms, but they had resolved by the time I got there, because it was an hour and a half drive to Abilene. Yeah. So I was like, they're resolved now. I just had this feeling earlier, and I still am having lots of neck pain, tons of neck pain, which I hadn't been having as much in the hospital. And so then they just gave me muscle relaxers and then something for the pain. And I did have, I don't know what kind of pain that was. I don't know if it was because I was really tense, and like my shoulders were way up here, because I was just like, nothing touched my neck. Like, still now to this day, I'm like, don't touch my neck. Do not blame you. Yeah, I'm just like, no. People pop their necks around me. I'm like, all right, I'm done. Y'all go do that somewhere else. Like, I cannot. I'll
make sure I don't do it, because I do it quite a bit.
Yeah, no. I
got slip discs. I'm back and forth.
Don't do that crap around me, okay?
I won't. I guess I haven't ever.
I'll shriek. I'll be like, don't
call me out for it. Like, stop that.
Yes, and that's another reason why I don't really, I don't believe in people popping their necks. I don't believe in any kind of chiropractic care, which I know a lot of people are fans of, but I just personally do not, I tell my family, I'm like, don't go to the chiropractor. And they're like, why? And I'm like, because literally the first thing they asked me was, did you go to a chiropractor? And I was like, no.
Could have caused that.
Yes. Whenever they're popping your neck, whenever, they do the pop, it can give you an artery dissection. And I've heard of I've met 2 people that happened to them. through this. And then a few, like 2 people in person, but I've met several of the people in that group that I had on Facebook that were going through that had been to a chiropractor. Also, whenever I went to go see Dr. Welch in Dallas, he told me that it was chiropractors, and actually, funny enough, it's people that do those extreme workouts, like those HIIT workout programs where it's just like constant moving and like jerking around.
Yeah.
Like that jerking movement can cause it too. So I'm like, no, I don't like that.
You also, I think we talked, you haven't had a massage before too, and you don't want people
I don't want people
you
touching
there
my neck.
for that reason.
No.
Yeah.
And even like, I'm like, I just don't like massages at all, honestly. And just like, no, thank you. But I think a lot of it has to do with that. I just don't even, no, thank you.
Yeah.
But, I mean, yeah, he made me feel, my doctor over there made me feel like I was normal and I wasn't going crazy. And then he made me laugh because he's like, these people in these small towns, he's like, you can have all the healthcare you want out there, but they're not going to be experienced in stuff like this because this is where we're experts at and they won't know.
There's a reason they're there.
Exactly. And he even told me, he's like, I recommend that you move to Dallas because this is a very specialized area of care, and you living in a rural area where people don't know what they're doing when it comes to this is not ideal. And so he told me, he's like, you need to move to Dallas. And I was like, well, maybe I should move to a bigger city. So that's why I ended up moving closer to Austin. So that way I could kind of have more access to healthcare.
Did you go to Austin for healthcare at that point?
Yeah, and down there? Yes. That's the main reason I went to Austin, was because I wanted to be closer to a big city in case something did happen. Just being closer to more specialized healthcare. Because here in a rural area, even trying to find a neurologist you have to go to Abilene half the time, or you don't have options. You only have one option, and that's it. And I like to hear what they have to say and get to know what their approach is about it before I even decide. Like I said, whenever I went to Temple and she was just like, you're crazy. How would you know if you have a blood clotting disorder? And it's just like, this could have prevented the entire thing. Had I been diagnosed right then and there, I would have been on medication and I wouldn't have had this problem. Even if I would have had a dissection, because people have dissections, because it was only on the first layer, it doesn't necessarily mean that I should have had a stroke. Some people have dissections, they don't realize it, and they never have a stroke.
The clotting causes stroke, right?
Yes. Yeah. It was a mixture of the two things, so it was the perfect storm. And whenever I was looking back at precursors, like what was it that caused this, I do remember in the morning waking up and my shoulder on this side hurt, which is the side that dissected. It hurt. So I don't know if I had fallen asleep with my arms up or what, but my entire shoulder hurt. Like I was even grabbing it like this, and I even contemplated about going into work because it hurt that much. But then all of a sudden it stopped hurting. Like just as soon as it came on, like as soon as I woke up, it was hurting. And as soon as it started, it went away. And I was like, okay, well, that was weird, Yeah. And I remember thinking, today's the 13th, September 13th, and having a really weird feeling about it.
That's still a weird day for you, I'm sure.
Yeah.
Like an anniversary.
Yes, very weird. Yes. And so I remember thinking that, and I remember I was like, well, it's not Friday the 13th. And I'm like, but it's September 13th. I was like, 13th is always a bad day. But I've never really thought that before. So it was very strange that day I happened to think of that. And I was just like, oh, it's foreshadowing. There's foreshadowing. So, but yeah, the only thing I remember is my shoulder hurting. And then I remember I had a headache that day. I never get headaches. And that day I had a headache on that side. And I asked my friend to give me medication, and she gave me ibuprofen. And I was like, dang it, I wish you would have given me aspirin, because
it would have thinned everything down.
Yeah, it would have thinned it at least a little, but then they might not have caught it if I hadn't had such big symptoms.
Aren't there people that have to take aspirin every day for that reason? Is it good for just the average person to take it?
It just depends. Like,
is it bad on your liver?
I think it's Tylenol that's on your liver.
Okay.
Yeah. So
that's acetaminophen.
Acetaminophen, yeah. But the aspirin, it just depends. if your doctor recommends it or not. If you have, some kind of issue that they think that you need to be on something, that's okay. Because it just depends. If you give full dose aspirin, it can work as like a blood thinner.
Okay. What's a full dose?
I don't know, whatever full dose is. I can't, you'd have to look at the bottle.
You're just talking like a couple pills the bottle tells me to take as a full dose?
No, not a couple pills, just like one. If it tells you to take one,
yeah, that's a full dose.
Yeah, that's full dose. You. But the one that I had usually worked with were the 81 milligram aspirins, and that's the kind that you give like if someone's getting chest pain.
Okay.
And it's kind of to prevent any kind of heart attack, but it's a low dose.
Okay.
Does that make sense?
Yeah.
I think the full dose is like 325 or something.
Okay.
So that's the difference on that. I don't have the info in front of me to
be
100% sure.
So if I understand correctly, so blood clot to the brain is a stroke, blood clot to the lungs is pulmonary embolism. Is that right?
Yes, and it could actually be considered an emboli if it's going to your brain as well. They classified mine as an ischemic stroke because it clotted and then the blood couldn't get to the brain. So it was considered an ischemic stroke. They have embolic strokes as well. Okay. And then they also have hemorrhagic strokes, which are the bleeding strokes, which those usually have a much worse prognosis. Yeah. So there's a difference with that. But yeah, that guy made me feel like I wasn't crazy. Really educated me. And so I did have a few times where I would still go in and I was exposed to way too much, imaging and all of that stuff that's not good for you. But overall now I feel like I'm a lot better. Yeah. And I feel like what helped me with that was just moving away from being in the middle of nowhere. I felt like that made me a lot more nervous half the time.
Just being closer to better healthcare.
Well, just even being closer to town, yeah. And just like having more people around me helps me to feel a lot safer because I'm like, at least if something happens to me, like my kid knows who to call or, has a neighbor or whatever. Being out in the middle of nowhere, it's like, what are you going to do, Yeah. It'd be days before anyone goes out there, so. We
talked a little bit the other day, but I think you told me there's certain workouts that you avoid for that reason.
Yes. So he told me that, he was talking about the HIIT exercise routines. He said those
high intensity interval training.
Yes, because they have a lot of like jarring movements. Yeah. And he's like, you can hurt yourself.
So you probably couldn't do CrossFit either.
Yeah, CrossFit. Yeah, those, and then those are the ones that people most likely get injuries for too. Like
that's bad on your body.
When you look at it, they get more injuries.
I did tire flips for a while as part of my workout, and it was just tearing my body up. Yeah, I'm sure I have a tractor tire back there.
Oh, really?
Yeah, and it was just wrecking my body. I had to quit.
Yeah, so a lot of people don't think about that. And so, like with me, they said there's no telling because, I went through all sorts of genetic testing. So they were freaking amazing. The way they treated me, they sent me to a geneticist to see if there was any type of pre-exposing or anything that could have caused that. And everything came back perfectly clear. And so they were like, look, you don't have any problems with your vessels. You don't have any issues that are known or we've discovered yet. So, and I was expecting to at least have like some, some testing that says I'm more predisposed to, have certain type of cancers or something. They tested me for everything and I was good. So I was really, really happy with that.
It's got a peace of mind that they did that full spectrum of testing finally.
Yes, and I was able to learn a lot about the different disorders that cause that. Like the one that they were most worried about was Ehlers-Danlos, and it was the vascular type, and that can affect the integrity of your actual vessels. And so they thought maybe that was why I had dissected. But then whenever they looked into it, they're like, your vessel healed perfectly. There's not really any issues with it. It has just like a tiny bit of scar tissue, but it's a champ, it's back where it needs
to be. It's good
to
go.
Yes. And then it's patent, meaning there's adequate blood flow through it.
You said patent?
Yeah.
Okay.
Like it's open, has great blood flow. So as good as it can get, you know what I mean? And so they said it was just a freak accident. And, was glad that I got answers, and that I was so vigilant in like getting answers the second time around, because I was like, I just didn't trust anybody at that point. I'm like, look, I looked for healthcare. Y'all told me I was fine. You made me feel crazy for even considering that I had a blood clotting disorder, and now you're telling me that I not only have a blood clotting disorder, but I also have a stroke that I just had. I'm just like, come on, man, like, which I know it wasn't the same healthcare system. It was Baylor's Gone White, and then this is Hendrix, so it's completely different. But I'm just like, it's very frustrating. And then to not be heard as a nurse, I'm like, I can't imagine any lay person, or even if somebody had a communication deficit, like let's say if somebody was of Hispanic origin and was speaking Spanish and was trying to get this across to the doctor, if I was dismissed and my concerns were dismissed and I'm a nurse, I cannot imagine
the average Joe
that
happens
just
to
going.
Yeah.
So I will never go to Coleman Hospital again in my life. That's just a personal preference. And I mean, I agree with the Dallas doctor. Like whenever he was like, dude, those are rural places. You're not going to get quality healthcare out there. It's like the best of the best are here. And that's why you need to move here,
Yeah.
And I agree with that. Like the healthcare, it was very, very tempting for me. And that's why I ended up moving to Austin. I was just like, I need better healthcare access. But ultimately moved back